While the planet waits anxiously for a COVID-19 vaccine, World Immunization Week really underscores how important inoculations are to public health around the world. Now, the problem under the pandemic is that it's pressed pause on other routine immunizations for things like measles, and that threatens the lives of well over 100 million kids around the world, mostly in the developing countries. Now, let's look at this through a local lens with pediatrician Dr. Dina Kulik. Doctor, thanks for joining us.
Thank you.
Let's start here. How concerned are you that infants, kids, young Ontarians are falling behind on their immunization schedules since the outbreak? And what are the risk factors of delaying a vaccination schedule?
Yeah, I am actually quite concerned. I've been speaking about this with my own patients and my community for actually a few months. I do have significant concerns that many kids are not coming in for their routine visits, either because caregivers are concerned about bringing them to health facilities and clinics, or because their physician is not available to see them because of their own shortages of PPE or their own health concerns. And this poses a really large challenge because though kids are home now and they're not interacting now, so their risk of getting illnesses that are vaccine preventable like measles and like whooping cough are low, once they head back to school and daycare, we are going to have a big population of people that are under vaccinated. And once they start going back to things like school settings or going to clinics to then get those vaccines, we're going to have a lot of people in a small space that don't have all the required vaccines. And we may see a surge of vaccine preventable illnesses, which, by the way, typically make kids much more sick and have a higher mortality rate than does COVID itself.
What about vaccines for teens, young adults, things like HPV, tetanus, shingles, etc.?
So the recommendation right now is that babies should be coming in after birth to make sure their weights are good, they're not too jaundiced, they're not too dehydrated. And from that point on, we should be seeing babies in the office for vaccines and for routine visits at 1 month of age, 2 months, 4 months, 6 months for vaccines, and 12 months and 15 months for vaccines. After that point, the vaccines can be delayed a bit because they're mostly boosters or ones that are not so urgent, like the HPV vaccine or hepatitis B vaccine that we give in schools in grades 7 and 8. These are not urgent. The kids are not likely to die from these illnesses, whereas things like measles, mumps, and rubella and whooping cough, as I mentioned, and pneumococcal bacteria, these vaccines we're giving in the younger babies. And I do worry that once we're being exposed more, that the rates of these illnesses will start to rise. So we are recommending those other routine vaccines, even now, even in the current climate with COVID, if your practitioner is able to give vaccines right now.
Doctor, I need to get your take on the vaccine averse or hesitant population. Not all of these parents are quote unquote anti-vaxxers. Frankly, they're an easy target, right? They're often vilified as being science deniers or troglodytes. Some of them are, right? Because there's all this fake news and mis and disinformation in the digital domain. But many simply have questions and concerns about how necessary a vaccine might be and if there are any side effects for their kids. So how do you reconcile this as a medical professional?
I think it's hard for some caregivers because they don't necessarily see these illnesses anymore. A typical person doesn't really know what measles looks like in a child or how devastating an infection with tetanus could be, or they don't know someone that's died of meningitis. But these are real illnesses that affect actual children in Ontario and in Canada and around the world. As a health practitioner, I once took care of a patient abroad that had tetanus, and I've never seen that much pain and discomfort in another person, and there wasn't anything that we could do to make that person feel better. And I've sadly taken care of kids in hospital settings that have gotten infections like meningitis and have succumbed to it. So until you've seen it or heard about it or know about it personally, sometimes it feels too distant, not really at arm's length. That's part of the challenge. People think these illnesses don't really exist anymore, and that the herd immunity, the population-based immunity will protect their child. It's hard to rationalize that when it seems so weird to inject your child with something.
Right. I mean, it's like with climate change, it seems abstract to many people until it's, it doesn't really trigger fight or flight until it's in your face or in your backyard. Right. And that's what this particular virus is right now. COVID-19 is with us. We're seeing the effects, even people that are very anti-vaccine. Do you think once that vaccine is developed for COVID-19, maybe some of these people that are, very reluctant to even think about it might think twice?
Possibly. I'm hoping so. I mean, hopefully it doesn't take this kind of pandemic to cause that. But a few years ago when we had a measles outbreak in Canada, I had personally families in our practice that came in to get the measles vaccine that had been vaccine hesitant. Once they saw that it was a real risk to their family, they were more likely to take that vaccine. So hopefully this does increase vaccine rates so we can get that herd immunity for all these vaccine preventable illnesses.
Dr. Dina Kulik, it was a pleasure and an education. Thank you. We'll talk soon.
You're welcome. Stay well.
You too.